Dr. Kohls, can prescription drugs be addicting?
Oh, absolutely. One of the most addicting drugs is the class of drugs called benzodiazepines, which are the Valium, the Klonopin, the Ativan,
Oh,
the Xanax.
yes.
Terribly addicting. And in fact, doctors aren't supposed to prescribe those for more than a very brief time, just for a brief anxiety or brief insomnia. And yet, it probably takes less than a couple weeks for some people to become so dependent on that that they have withdrawal symptoms when they quit. They may take it for a couple weeks and then their prescription runs out, and now they're having worse anxiety because they're going through withdrawal. Anytime you have withdrawal symptoms, stopping a drug, by definition, that was an addicting drug. So the Valium is just notorious. It's been on the market for 50 years, you know.
Back in the 50s, that was the housewife and the Valium thing.
Right.
They were overprescribing Valium.
That's right, yeah.
And then they would have cocktails, and that would exacerbate it.
Yeah, and there's still people on Valium now that can't get off of it. For 50 years, they can't get off of it. And so then they come up with a new one. The latest one is Klonopin, and they say, well, this was less addicting. Well, it's because we don't have any experience, very much experience yet, to find out how addicting it actually is. So the drug industry kind of hides the bad news.
What about the antidepressants?
Yes, they're addicting too, yes. My practice is largely helping people get off of their drugs. People come to me, they've been on drugs for a while, they try to go off themselves, they have terrible withdrawal effects, have to go back on it to ameliorate the withdrawal, and then their doctor doesn't know what to do. Doctors are good at prescribing drugs, but not at taking them off. Nobody wants that responsibility. My practice has evolved into being the doctor that takes the responsibility for helping people get off. And it's hard work, and it's risky, but these people are suffering. And so I developed a method which has been fairly effective. I've taken hundreds and hundreds of people, helped them get off of their medications. And it's a complicated thing and kind of hazardous because it's hard work for the patient too, because they have to go through withdrawal.
So they wean themselves off? They cut the dose?
Yeah, it's a slow process of weaning, and there's a lot of factors that are involved. The length of time the person's been on the med, the combinations of meds, the dosage strength, how malnourished they are, whether they're smokers or they're caffeine addicts or
even if they drink, right?
Or alcoholics, yes. And how malnourished they are is a huge one. So it's a combination of slow, gradual withdrawal and nutritional support for the brain.
But most people didn't know that these drugs were addicting, right?
That's true,
You could just maybe take them through a grief period and then stop taking them, but that's not true, correct?
Well, it depends. Some people can do that and have very minimal withdrawal symptoms. If they take them, if they've been on them just for a short time or a low dose. I've had many of my patients come back in a week or two after the first visit when I've said, well, let's just go real slow. And they come back and say, I just quit, and it's fine. So it depends on a lot of factors, some of which we may not even understand. But it probably depends on the length of time, how many drugs they've been on, what the dosage strengths, how high the dose is, etc. When people come in and say, I've been on, Prozac for 15 years, and I've been on Trazodone for 10, and I've been on Effexor for 5, I roll my eyes and say, I don't know, this is going to be tough, and do you really want to go through this? And I tell them about the withdrawal symptoms and the nutritional supplements they'll need to take in addition, and it may be too overwhelming for some people. If people don't have any support, if they're all by themselves, they're already on disability because of the drugs, disable the brain, and they can't work sometimes. And they're heavy smokers, and they're heavy Mountain Dew drinkers, and they're couch potatoes. They may not have the emotional strength to go through this. They may be doomed. I try, but if they're isolated and there's no family support, or the family sabotages it, or they say, don't take him off his drugs, when he tries to go off of them, he goes crazy, and he's going through withdrawal, it's not his disease coming back. The family will oftentimes not want that to happen, because sometimes they go through withdrawal and decompensate and wind up back in the hospital. And that does happen, but it's the withdrawal from the drug and not their disease that's doing it in most cases, in my opinion.
Well, they weren't diseased in the first place, in all likelihood.
That's true. They may have been nutritionally deprived. They may have had post-traumatic stress disorder, the psychological trauma from all the violence that they may have been subjected to. And just as an example, one of my areas of expertise is the combat post-traumatic stress disorder from Vietnam. These guys come back, just have experienced just gruesome death and violence and the fear of their own death and killing people and killing innocent people and blood and guts and just horrible suffering that they've experienced. That changes them forever. And they come back and they have flashbacks and they have nightmares and they're suicidal and depressed and anxious and manicky and all. And they get labeled by the VA as paranoid schizophrenia of unknown cause rather than post-traumatic stress disorder with psychotic features or with flashbacks. They call them hallucinations, so they're automatically schizophrenic. So then they get on a drug. They get on a schizophrenia drug, or they get hospitalized or committed or wind up on the street, unable to work, die in the gutter, drinking to assuage the pain. And so those aren't mental illnesses. That's what happens to normal people when they're in crisis situations. But the brain has been neurologically affected by the bad food and the lead from the bullets and the smoke that they inhaled and the diarrhea that they had and the depleted uranium now in the case of Iran, the Iraq veterans. Those are all toxic substances. All the shots they get had mercury in many of them. So they're mercury traumatized brains too. The brains are just not.
So they're not
diseased.
Mental. They're toxic.
It's neurologic.
Is that what you're saying?
Oftentimes, yes.
And they're very toxic.
Right.
Okay.
So it's emotional.
And the
stress.
emotions are toxic too, right?
That's right. And the emotions are toxic permanently, perhaps, or at least long term, because when people are under chronic stress, their adrenal glands are pumping out cortisol, which is brain damaging, and adrenaline, which is brain damaging. And we can tolerate that. Humans are supposed to have cortisol and adrenaline surges from time to time when we're afraid or running away from danger. But when it's a 24-hour, 7-day-a-week thing, it harms the brain. And so people are under chronic stress, as in the war zone, or just being a refugee, or being a victim of the war, or being abused at home. Any of those chronic traumas alter the brain as well, anatomically and chemically. So it's not just, we don't say, well, we don't understand why somebody can't forget the rape. There's something else going on besides the emotional stress or the crisis. It's a chemical kind of damage that's being done too. And that all then results in altered brain cells, which need nutrient help. And the things we mentioned earlier with the omega-3 fatty acids, the amino acids, the vitamins, minerals, and antioxidants, and good food, and avoidance of more toxins from this food supply or the water or whatever.
Okay. Well, thank you very much.
You're welcome.